This weekend lecture, we discussed national databases and how they may be useful in the future for obtaining and discovering information. However, I believe that this is more of a disadvantage than an advantage because these databases may only be accessed by developed countries, and even then, not everyone is skilled in technology or can understand the data that is distributed. Creating these databases is another obstacle in itself. Bringing public health issues to attention to the public is important, but it is difficult to provide access to all people of all countries. Not everyone wishes to use or can use these means by officials to their benefit. Another topic that was discussed in the lecture was the idea of public versus private tracking. Personally, I would rather keep my life private than have anyone in the world be able to know what I was doing in my daily life using apps such as Instagram, Facebook, Snapchat, or Twitter. Some people may post very vulnerable or revealing thoughts as a way to release any stress or feelings they may have, but I believe if the wrong person find it, it may be detrimental.
Hi, my name is Jaren, and this week in class we talked about data tracking through social media. Companies and they track and record data through what people tweet and post and stuff like that. Nowadays, nothing is private anymore, anything on social media, but in a public health perspective, it should be looked as positive and beneficial because it can help prevent things from happening and keep people informed of what's happening. An example of this, how data tracking could have helped something, is the example in class where someone was tweeting on Twitter about how about bad stuff, and then he ended up going to school and shooting a couple people and wounding some. This could have been prevented if people knew more about it. And yeah.
The first reading shows how internet searches can actually predict future emergency opioid-related visits. So it means that it works and it's actually a valuable resource, and it means that we can use it for other stuff too. It doesn't have to be just opioid-related cases. And it's also something that can evolve over time so there are many who are aware of the opioid crisis and that there's a need to address it, but it's hard to address it and prevent it when there's no recent data. And the most recent data is from years ago, so it's hard to do a study when you don't have any reliable data to go on. But internet searches are now a new source that people can use, and it provides real-time insight into people's behaviors and their intentions with opioids, and it's cost-effective.
In the second article, the topic was on predictive analytics, also called PA, and how they are used in a healthcare setting. PA is used to help physicians and other clinicians make a decision on how to treat a patient's diagnosis. It can also be used to manage cost concerns and improve the workflow for the physicians. Since PA is used to help analyze large and varying amounts of data of the different patient's electronic health record, also known as EHR, it can produce more harm to the patient or not work in the patient's best interests. Personally, I think that PA should be used to improve physician workflow and help manage hospital or clinic cost concerns, but the physician should not use PA to help predict a patient's treatment. The article states that the physicians must use their own best judgment when it comes to treating patients, but I think that the physician should simply collect a summary of the patient's recent health visits and concerns and make a diagnosis or treatment plan from there, instead of using all of the patient's health history information.